Good afternoon. For the record, my name is Daniel Fernandez Anderson, the District 7 City Councilor. I am the chair of the Boston City Council Committee on Ways and Means. This hearing is being recorded. It is being live streamed at boston.gov/city-council-tv and broadcast on Xfinity Channel 8, RCN Channel 82, and FiOS Channel 964. The council's budget review process will encompass a series of public hearings that began in April and will run through June. We strongly encourage residents to take a moment to engage in this process by giving testimony for the record. You can do this in several ways. Attend one of our hearings and give public testimony. We will take public testimony at the end of each departmental hearing. In this case, if people do show up after round one of questions, and the full after round one and then round two if time permits, and also at a hearing dedicated to public testimony. The full hearing schedule is on our website at boston.gov/council-tv. You can give testimony virtually via Zoom. For virtual testimony, you can sign up using our online form on our council budget review website or by emailing the committee at ccc.wm@boston.gov. When you are called to testify, please state your name and affiliation, residence, and limit your comments to a few minutes to ensure that all comments and concerns can be heard. Email your written testimony to the committee at ccc.wm@boston.gov. Submit a 2-minute video of your testimony through the form on our website. For more information on the City Council budget process and how to testify, please visit the City Council's budget website at boston.gov/council-budget. Today's hearing is on docket 0760 to 0762. Orders for the FY24 operating budget, including annual appropriations for departmental operations for the school department and for other post-employment benefits, post-OPEB. Docket 0763, 0765 to 0766. Orders for the capital fund transfer appropriations. Dockets 0764, 0767 to 0768. Orders for the capital budget, including loan orders and lease purchase agreements. Our focus area for this hearing will be an overview of the FY24 for the Office of Emergency Management and Office of Emergency Medical Services. Our panelists for today's hearings are, is it Shemaine Benford?
Yes, that's Shemaine Benford. He's having some trouble getting his Zoom set up, so I'm going to help him hop on right now.
Thank you, Andrew. Chief of Emergency Management in Boston Housing Police, City of Boston, Boston Housing Authority. James Foley, Chief of Emergency Medical Services. Team, oh, here we are, okay. Hey, Chief, you're with us? Hello. Tim Harrington, Director of Administration and Finance. I'm joined by my council colleagues, Councilor President Ed Flynn, Councilor Lujan, Councilor Braden, Councilor Coletta, Councilor Flaherty, and Councilor Mejia. For the format of our hearing, I'll go to my council colleagues for 30-second opening statement, and then I will go to the administration for their presentation. Then round one of questions. Each councilor will have 8 minutes for their line of questions, and I will pause you at 8 minutes and go to public testimony. If we are not, we have no one signed up for public testimony, I will go straight to round two of questions. If time permits us, we will do another 8 minutes and then straight to closing statements. Council President Flynn, you have 30 seconds for your opening statement.
Thank you, Madam Chair. It's good to be with you. Good to be with the administration team. Chief Foley, good to see you. what I want to focus on is well, I want to thank Chief Hooley for working with me in residence to try to establish a EMS presence in the South Boston waterfront. It's critical. It's a huge neighborhood without basic city services. I also want to ask the chief what we're doing in this budget on health and wellness for his dedicated and professional EMS team. And for the emergency management team, I'm looking to hear about emergency evacuation routes if there was an emergency in Boston. These are issues I focused on and worked on when I lived in Guantanamo for a year. So I'm interested in knowing what your plan is on emergency evacuation routes if there is any type of emergency in Boston. Thank you, Madam Chair.
Thank you, Council President Flynn. Councilor Jen.
Thank you, Madam Chair. I just want to thank EMS, want to thank Chief Woolley, want to thank Office of Emergency Management, Chief Beaufort for their commitment and work on behalf of the city and all of their staff. I think I've been incredibly encouraged by seeing the new classes coming out of EMS, extremely hopeful for our city, for folks having film-sustaining careers, excited about the promotions that we've been seeing out of EMS as well. So just here to learn more how we can better support as a city council the needs of EMS and OEM to make sure that we are prepared for when our residents face emergencies and crises, whether it's a fire or a larger scale event. So thank you for your service to the city, and I look forward to our conversation. Thank you.
Councilor Braden. Councilor Coletta.
Thank you so much, Madam Chair. I'll be brief. I just want to thank everybody for their work and their service to the City of Boston. I have really enjoyed working with OEM and EMS to address some of the needs of our residents in East Boston, Charlestown, and the North End. I do have some comments about coordinating for building collapses, as well as planning around the Sumner Tunnel closure, and similar to Councilor Flynn, what our response will look like when we have major events happening, including major storms and flooding. It's not if, but when the next hurricane will come. So I'd love to talk through that, but then getting into specifics of this budget. So looking forward to that. And thank you, everybody, again, for your work.
Councilor Flaherty.
Thank you, Madam Chair. My questions will be obviously on the line of making sure that we have sufficient personnel, given that our city continues to grow, and making sure that our response times, we're blessed in Boston that no matter where you are, if you have to call 911, no matter what the emergency, there's a relative expectation that blue lights, red lights, or orange lights will be at your door within a relatively short period of time. And so I want to make sure that that's going to continue, particularly for our EMS services as we see our city growing, and as well as our institutions growing. And also just making sure that from a public safety standpoint, and Office of Emergency Management, that Bragdon Street, which is in the epicenter of our city, is in as best shape as it possibly could be to respond to whatever emergency comes our way. So I know that Mr. Harrington and I have talked about this on many occasions. So again, just looking to make sure that we have sufficient staff where our response times are something we're all proud of, and our emergency management is coordinating efforts with respect to Bragdon Street. Thank you, Madam Chair.
Councilor Mejia.
Hi, good afternoon. Thank you, Madam Chair, and thank you to the chiefs that are here and the department heads who are overseeing what I believe to be one of our most crucial departments. I'm going to be focusing in on some of the, in regards to emergency management, really curious about how we are incorporating our mutual aid and nonprofit partners in some of our responses and ways that we can be supportive on the council.
Councilor Mejia, did you get muted?
No, Madam. Thank you very much. Did you not hear any of? Did you hear anything of my opening remarks?
All of it, except I guess when you said thank you. You got cut off.
Thank you. Okay, thank you.
Councilor Worrell?
Thank you, Madam Chair. Thank you to OEM and EMS, and looking forward to this conversation. Great staff in both departments. Just want to find ways on how we can be supportive on continuing some of the initiatives and investments that were made last year to making our city safer and more sustainable and equitable. Thanks.
Thank you. Councilor Braden, I previously called on your name, but I think you got kicked out and now back with us. Did you have an opening statement? Okay. Welcome, Chief Hooley and administration. I see Tim and Jim. Is Shumaine? Is that okay? All right, we have everyone. Great.
Yes, no, back here, thank you.
Oh, your name is Shumaine.
Yes, Shu for short, if that's helps.
Oh, that's it. Well, Chief Benford, thank you so much for joining us. We always talk and I didn't ask your name.
That's all right.
All right. Oh, well, nice to see your friendly face here. All right. Chief Hooley and Chief Benford, I don't know who wants to start, but the floor is yours for your presentation.
Chief Hooley, you want me to go, or would you, I'm happy to go in whatever order you think is appropriate, sir. Hearing none, maybe he's preparing. I'll go ahead and jump in if that's all right.
So go alphabetical order. Go right ahead, Chief.
You are an absolute gentleman. Thank you very much. Madam Chair, thank you very much for the opportunity to present today regarding the FY24 budget. I greatly appreciate the opportunity. I want to also thank the body and the councilors that joined us here today in the same space, engage in dialogue and debate on how best in ways that we're investing this precious money and resources, keep our city safe. I know that we're going to have a few moments tomorrow. Not everyone is able to join us, but look forward to those that are coming over. I greatly appreciate the opportunity to further our dialogue with you. I also want to thank Mayor Wu for her investment and support of emergency management in our primary mandate. And lastly, I want to ensure that I thank the budget staff, IGR, and my own staff, particularly Andrew and Malik, for the work that they've done in helping OEM be prepared for this conversation in FY24 discussion. With regards to the primary responsibilities in emergency management, we are and manage the primary suite of emergency plans on behalf of the city. We also serve as the fiduciary for the Metro Boston Homeland Security Region, which manages the UASC grant. And we also have a primary function for coordinating and managing across departments and across agencies during major events in the city. Some 2023 work that we did that tremendously impacted our standing as a department that is growing, a department that's continually evolving to meet the moment. Certainly, we have been having open conversations as well as leading efforts around the city's response to migrants and other individuals seeking support in this country in our city in a dignified way. Happy to report that, excuse me, as a department, we sought and was fully reaccredited by EMAP, which is the national accreditation body that governs emergency management as a discipline. And also want to mention, I think I heard one of the councilors or someone join earlier comments, the many TTX or tabletop exercises that we have put on here at emergency management on ask and request from other departments that really look to test interagency coordination. We are actively looking at evacuation and also some involvement around the city's reframing and rethinking the response to violence in the city. I also want to mention that the resources, excuse me, that we have go to support how we respond to events in the moment. And there were lots of lessons that we learned from the pandemic in terms of how we supported the city that directly led to requests for investments in FY24, and namely the logistics support staff. What we found in during the pandemic, excuse me, was that many departments that typically shut down at 5 o'clock and on the weekend suddenly found themselves as part of the open conversation around how do we manage, how do we continue to provide vital city services to our residents, and how do we do that in a way that keeps our workforce safe. And what we found was those departments that have very small, if any, operational capacity other than the day in, day out normal administration, we had to find creative ways to be able to support them. And OEM really did step into that space, hence the exclamation point in our logo. It's our emergency is a little less defined. While we fall under public safety, police, fire, and EMS, while we're a well-prepared city in responding to a range of different crises that we may confront, OEM really sort of scoops up some of the things that don't neatly fit into any of those three packages, or things that come up on the fly or in the moment that we have to manage too. So that logistics support position is going to be extremely helpful for us in not only having greater capacity to distribute and meet those demands, but also to do it in a safe way on behalf of our staff and our residents. Things like deploying VMS boards and deploying light towers. It's most safely when we have the right number of bodies, i.e. 2 individuals, that's helping to move that heavy equipment. Also, many counselors we support with requests around VMS boards, which is our video messaging boards that help to share information to our public in spaces like public parks that close at dusk and some as late as 10 o'clock to help send out that message and that we want this space to be open and enjoyable for everyone. So we put VMS boards out to help in that space. And this is where that second position will be extremely helpful. We also have a lease escalation clause for our space over here at Bragdon Street, which automatically kicks in, for which there is going to be an investment in. We also have a new deputy that's going to be coming on board, and that deputy will really serve as the number 2 executive in OEM, but also serve as the focal point for overseeing OEM's role and participation in the mayor's environmental agenda and helping us to better plan and think openly about how we adopt plans that represent new building trends, that represent how we're going to approach flooding or extreme weather. So this position is going to be extremely helpful and provide us with the opportunity to have a designated individual on staff that will be the point person in this space. I also want to mention just a couple of things around the evolution in terms of things that we've seen that sort of are part of how we live and how we must manage, but things that have come up which has expanded the capacity of OEM and highlight some of those areas that are a little less defined, but nonetheless we find ourselves involved in supporting. Resources that help us be prepared for the 21st century. Unfortunately, as we look at the warm weather, it's getting started earlier and earlier. In May, we see young persons, we see families going to the water, and unfortunately, in some instances, we have water tragedies. So OEM is there to help if there is a need to help coordinate across city departments to ensure that we're not only assisting where we can in the response, but also ensuring that there are appropriate connections with other city services to support the victims and their families. Our elections, working with the election department to ensure that the EOC is activated to not only meet the national priority for supporting elections, but also supporting us locally and ensuring that our election department has all the resources and support that they need to ensure that our elections go off unhitched and also have contingency plans if by chance we do bump into challenges or issues during the elections. Sadly, Game 7 didn't work out the way that we wanted it to yesterday, but nonetheless, we were working in partnership with the police department to ensure that we had representatives from various different departments. If by chance we had a clinching scenario where we did win and we needed to stand up the EOC to support a public safety response. Again, heeding and responding to Councilor Flynn's earlier ask in other instances, and better understanding how we coordinate them. I want to recognize, again, Councilor Flynn and really serving as that voice and that machine and engine behind getting, something on the calendar where we can welcome you all over here to the EOC, where we can tell you a little more in granular detail about the work that we're doing, which is supported at the highest levels by Mayor Wu. National SEER-rated events, which are really large-scale events that have national implications like the marathon and July 4th. So those are all critical events that come up consistently that we must manage to. We are also very proud of our equity goals and crossing and breaking down barriers to diversity and really thinking about how do we adopt plans that are equitable, plans that take into account the community's input. So we're really working hard to go that extra step to make sure that we have sound and effective equity goals. Looking at our employees and providing growth opportunities for our employees, particularly women and people of color, and creating growth opportunities for those that want to make OEM, the city of Boston, and our neighborhoods their home, not only professionally, but also personally. So we're very proud of the opportunities that we presented in-house and being able to do that. And that comes with the flexibility of the budget. We've been working with other city departments to identify suitable space for a growing department. I appreciate Councilor Flaherty's consistent support for OEM as well as public safety and in other disciplines across city government, and looking at space that's appropriate and suitable for the EOC. We're also looking at our emergency response teams, which really gives us that capacity to respond after hours and during critical events while balancing an appropriate work-life balance for our staff. So we have deliberate plans that we think do that. And certainly in the moment, all of our staff has always stepped up and will continue to be ready to step up in that space. We have great interstate, particularly at our major city level, with our counterparts in most of the major cities across the country, and being able to share information to help us think through how we respond, and that became extremely helpful during the pandemic. And lastly, wanted to highlight our work in really working with our stakeholders, particularly in our quasis like Water and Sewer Department, BPDA, strong existing relationship with BPHC, and also BHA to ensure that we're having a total site picture conversation when we're planning for crisis and thinking about how it is that we are going to support during time of major crisis or emergency. A couple of things, Madam Chair, that I did want to mention in responding to some of the councilors in their opening remarks. Councilor Flynn specifically talked about evacuation routes. And what I can say, sir, is that we just concluded a series of tabletop exercises. And those exercises were really designed to help us understand a couple of things, identified gap areas in our planning, helping city departments test their plans. We now have a better understanding of long-term care facilities to include hospitals so that we can appropriately incorporate that into our plan. We have the Regional Catastrophic Grant, which really helped us to look at disaster housing and what it means if we have to evacuate a neighborhood, and working with our state partners. It was clear based on our geographical layout in Eastern Mass, and particularly in the Boston metro area, that any major large-scale evacuation is going to include other jurisdictions. So we have to have open conversations with MEMA and other partners to help us better understand that. And one of the big things that we want to do is we are working with the mayor's direction in support of other departments to better understand extreme weather, to better understand water. So we're working with BPDA as well as Community and Environment and Open Space, and it really ties to that deputy's position that's going to be coming on, that is really going to have the primary responsibility of ensuring OEM's alignment for emergency planning in that space. And then lastly, the big one that we have to take into account, which was much less the case many years ago, is technology. How do we look at technology and factor in technology, platforms that are available, that are fiscally responsible, that may be available with other contracts in the city? How do we appropriately account for that and incorporate that into how we design evacuation routes so that they're of more utility for our residents? Councilor Flaherty, again, thank you very much, sir, for your unwavering and extended support for the EOC. We are working as best we can, and our staff is very effective. But we are a growing department, and happy to report that other city departments, to include budget, to include public facilities, to include the operations cabinet, are working alongside us to look at ways in which we can identify more appropriate space for our growing capacity and our growing needs to support our city. Additionally, which will support evacuations, will also support the department during emergency crisis. We are developing and rolling out training for our emergency response teams. That's going to be our first line of sustainable capacity, which would allow us to meet the moment and be available to respond to any of the major crises that happen in the city, as well as when we stand up the EOC during proactive events where we're planning in advance, like during the marathon. Councilor here talked about mutual aid. Typically, mutual aid agreements are executed at the city level, and it largely includes your public safety departments, namely police, fire, and EMS, that is generally supported by state statute within the emergency management discipline, because it really is a developing discipline that has really saw its foundational legs in the last 25 to 30 years when we think about it from a contemporary standpoint. We have what's referred to as the emergency management assistance compact, where we're able to rely on resources to come in, assist and aid our city in time of need. How that works, ma'am, is the city would exhaust all of its resources, then we will go to the state. From the state, we would go to the federal government, and it works in that order of ascension. With regards to working with our partners, what I would say, ma'am, is we are very much open to working with any NGO, state, federal, or city partners, but the ones that we consistently work with, for which we have very open, fluid conversation and fluid interaction with, are the American and the Salvation Army. And then lastly, Councilor Worrell did ask the question around investments in the past. Last year, our big investment was around...
Sorry, Chief. We're going to get into a round of questions after both presentations.
Okay.
Yeah, no, I think they were stating I will be asking questions about these issues, but we allow them to ask you directly so that in their time, they're going back and forth with you and getting clarification if needed.
Sure.
But if that closes out your presentation, if you wanted to just close out your presentation.
Yeah, appreciate that, ma'am. I would just say, yes, it does close it out. And I would just mention really quickly, respectful of time, Councilor Worrell talked about those investments in previous fiscal years. And the big one that we had was the onboarding of our coordinator for the CERT program, which is the Volunteer Coordination Program. We are substantially along in that space. We're working with corporate counsel and others to ensure that we have the right liability insurance, and we have documentation that's not only going to protect the city, but also protect the residents that are going to be serviced and those that are going to volunteer. So I do see that point, and I do apologize for that time and look forward to engaging in conversation.
Thank you so much. Chief Hooley?
Okay, coming up on the audio and sharing the screen. All right, do you have us?
Yes, we're ready for you.
Okay, thank you.
Thank you.
Just silence the phone. Okay. Well, hey, good afternoon, Madam Chair and President Flynn. My name is Jim Hooley, and I've served as the chief of Boston EMS for the last 13 years. Although the last year has shown a drop in COVID-19 cases and an end to the federal COVID-19 public health emergency declaration, the work has been no less challenging. The volume of calls has risen well past pre-pandemic levels. So since 1996, in accordance with Mass State Law, Chapter 147, Boston EMS has been a bureau of the Boston Public Health Commission. We're a two-tiered 911 EMS system with 21 basic life support ambulances, 5 advanced life support ambulances during peak day and evening shifts. 2022, we responded to 134,424 clinical incidents with 168,000 and change ambulance responses and 89,265 total transports of patients. We currently have 450 total positions with 460 planned for the coming fiscal year with the budget that's coming up. We'll continue to approach what we do through the lens of 3 strategic priorities. Our personnel, investing in their safety, well-being, training, advancement, retention, and recruitment. 2, our patient care, providing the best possible clinical care through investment in training, equipment, and new service models. And operations, ensuring everything else from systems to infrastructure are aligned to support our mission. Across these three priority areas, we strive to operate through a lens of advancing diversity, health equity, and inclusion. On the slide here, I think it's a little bit busy, but I think you can see it. Beginning with our first priority, our personnel, you can see from the chart that 2/3 of our members are EMTs, which includes the new hires in the Recruit Academy, members assigned to ambulances, and those working as telecommunicators up in dispatch operations. Paramedics, who comprise 12% of our workforce, have on average 19 years of experience with the department, ensuring that they have the skill to handle the less frequent but more acute, life-threatening emergencies. Members in our supervisory and leadership role principally support field and dispatch operations, training, and special operations. And we are supported by 27 non-uniform members who serve in mechanics, supply, IT, budget, facility, and administrative roles. As an investment in our personnel, we ensure that we have the most appropriate personnel protective equipment, including everything from masks and gloves to body armor, which we update on prescribed time frames. We continue to build upon our investment in peer support, expanding our peer support team and our contract with the on-site academy, as well as incorporating behavioral health training in our in-service program for all members. Additionally, we have sent members to trainings across the country to build competencies in leadership and preparedness. In July of last year, we hosted a leadership training for approximately 50 members. And in November, we coordinated an international conference at the BCEC on violent extremism with hundreds of attendees from 65 different organizations. Through our affinity group, the United Coalition of EMS Professionals, or USEP, over 20 scholarships have been provided to department EMTs for paramedic certification training. Grant funding has been secured to provide at least another 10 scholarships. Last week, six of our members who got the USEP scholarships graduated from Bunker Hill, completed the program, and they're in the process of completing their ride-along time and other hours that they need to sit to take the qualifying exam, which will then qualify them for the promotional step to a paramedic. So we're pretty excited about that. This fiscal year, we promoted paramedics, lieutenants, deputies, and superintendents with more promotions anticipated in FY24. On average, personnel have 12 years of experience within our department, speaking to a degree of success and retention, although we hope to do better by adding more frontline resources to reduce the workload through expanded promotional and reassignment opportunities with investment in their well-being. Sometimes one of the reasons people cite in when they leave prior to 7 or 8 years is the workload, and they want to go to a place where it's a little bit less busy. I'm sorry to say. Last week, we hosted the first annual awards and retirement banquet since the onset of the pandemic. We provided 50 awards to more than 100 department members. We recognized 44 retirees. We had to make up for the last 4 years of having to not be able to do that. In the last 5 years, approximately 100 city residents have received scholarships to our EMT course, where they can train to become EMTs and then be eligible to apply to be recruits for us through a partnership with the city's Office of Workforce Development. And we're going to continue to offer over 100 more in coming years. Training EMTs is the most effective recruitment strategy. This year, we plan to take it a step further and offer a cadet program, allowing individuals to get paid while they become EMT certified. We have 3 recruit academies scheduled and 2 cadet programs scheduled for the fiscal year, for fiscal year 24, allowing us to address some current vacancies and continue to expand with the investment of 5 more uniform positions in the budget that you're considering this year. We also requested 5 non-uniform positions, which will allow us to reinstate administrative and support positions that we had cut back in 2013 due to budget constraints. For our second priority, we've taken a number of measures to enhance patient care, but in the interest of time, I'm going to focus on just the ones related to mobile integrated health, emergency care, emergency department avoidance, or MIH. MIH is intended to connect patients to the most appropriate points of care, improve patient outcomes, reduce healthcare costs, and promote health equity. In July of 2022, we became the first EMS organization in the Commonwealth approved by the Mass Department of Public Health for MIH ED avoidance. Since then, we've rolled out 2 programs, and we have a 3rd in the works. On this slide, this will give you a representation of what MIH is. The traditional means, which we still are very much reliant on. Remember I said over 134,000 calls last year and 89,000 transports. The 911 in the black that you see, 911 ambulance and hospital, that's still there. But if you look off to the sides, what we're also able to do is the chart in blue shows the changes that MIH avoidance allows for, which represents a little bit of a change to our operations. It allows for some calls to be routed directly from 911 call takers to telehealth clinicians. In October of 2022, we launched what we referred to as TeleBest, so that low acuity behavioral patients who meet the eligibility criteria, and if those callers are willing, behavioral patients, they can be connected to a health clinician at the Boston Emergency Services Team, or BEST, call center. Since April this year, we expanded this to a 24/7 program with approximately 80 calls successfully transferred to date. Next, in instances where we do dispatch an ambulance, we can expand from solely offering transport to a hospital to also providing treatment in place with clinical oversight and an alternative destination to transport. In December of 2022, Boston EMS added the option of transport to transport substance abuse use disorders to the Boston Medical Center's Stabilization Care Center. All SCC patients must also be within the BMC catchment area and has to be approved by medical control, and the patient must agree. So there are safeguards. We're very careful about who gets selected for that or who has the option for it. To date, 19 individuals have been transported to the SCC. The goal for both of these is to, in cases where we don't want to pay, some patients aren't always best served by going to an emergency room, and they may be triaged to waiting areas or urgent care for a while, waiting to see somebody. If we can direct them directly to a clinician on the phone for mental health follow-up or get an appointment made for them someplace, we can do that in many cases now with TeleBest. And for the SCC, we can get people into a setting of like low threshold setting to get them in, but with clinicians there where they can actually start their treatment, start the Suboxone, start the intake, and avoid the emergency room step. Lastly, we're able to dispatch non-ambulance alternative. We will be able to dispatch non-ambulance alternative response units, which can provide treatment in place and transport to alternative destinations. This summer, we plan to deploy an alternative response mode. Say that fast 3 times. Alternative response model unit, which will be jointly staffed with the best behavioral health clinician and an EMT. Our third priority focuses on systems, infrastructure, and equipment, which are essential for our personnel to effectively carry out the mission. We are grateful to the city council for your concurrent investments in facilities in West Roxbury and the Seaport. West Roxbury facility will house our training department, a new academy site, and a two-bay ambulance garage, which is very much needed in that end of the city. The two images on that slide that show the current construction, which is in progress, and the anticipated move-in date being December of this year. The Seaport Station, located at the very end of Dry Dock Ave, with construction scheduled to start this fall and conclude a year later in the fall of 2024, is very much on schedule. The siting, the design, a lot of the studies have already been done, and that's well underway, thanks to the investments from the city. Other investments include our radio infrastructure upgrade, which was a $22 million infusion of capital funds. We're into year 3 now of replacing aging radio infrastructure, and it's going to be piggybacking on the same network with the PPD and a lot of the infrastructure that the fire has. And so there's a cost sharing that way and economies of scale, and it's we're building a much better system. Let me speed up quick. Our investments also include, we're looking at systems to support early identification of cardiac arrest and other critical illnesses, with some systems improvements that we're doing up at dispatch operations for when calls are entered to help us alert us to that earlier on and streamline call entry for that. We continue to build on our research and fellowship partnership with Mass Institute of Technology. We're on a replacement schedule for all of our essential equipment. We got on a replacement schedule for ambulances, thanks to you all a couple of years ago, but now we're also on a replacement schedule for our LifePak 15s, our 12 EKGs, our stretchers, our automatic external defibrillators. So nothing exceeds the manufacturer's recommended lifetime. Body armor, everything is on a schedule now. And as well as some new devices called the Lucas device, which is a battery-powered external thumper that we can attach to a stretcher, which will maintain CPR even when we're moving patients long distances. It helps on the fatigue for rescuers, but it also keeps the compressions up, and it's proven to have some pretty good cardiac outcomes during cardiac arrest. And last slide. As you can see from this fiscal year on revenue and expenditures, 2023-2024 budget breakdown, wages and associated fringe benefits represent 85% of our budget, with the remaining funds covering our non-personnel expenses, such as facility leases, ambulances, fuel, medical equipment, supplies, drugs, everything else. You can also see that although our city appropriation has gone down, our overall budget has increased. This is due to increased revenue, mainly due to Mass Health increased their rates by over 30% this past year. An additional call volume. We have not changed our rates. Mass Health was the lowest payer in the system, but they did raise their reimbursements to services now, and it's a little bit closer to what Medicare is, and so that has certainly helped all of us. And that's all I have. Thank you.
Thank you, Chief Boyd. We'll start with our round 1 of questions. And in the order of arrival, Council President Flynn, then Councilor Jen, then Council Braden, Council Coletta, Council Flaherty, Council Mejia, then Council Worrell, if he's still here. I guess we'll stop at Council Mejia. Council President Flynn, you have the floor.
Thank you, Madam Chair. Thank you, Chief. Chief, over the last 3 years with the pandemic, your EMS team saved so many lives across the city. But I guess my question, Chief, is what impact has the stress had on your team working nonstop, assisting people on medical calls? And specifically, I want to ask, what are we doing in terms of health and wellness for the men and women that work in your department?
Thank you, Counselor, for asking that. Yeah, certainly that a couple of years in COVID, it was difficult for everybody, right? Imagine even people who, very few of our folks would be able to work remote to do the job they're doing, right? Whether it's in dispatch or out in the field, but a lot of people still had maybe kids or loved ones at home. So the work-life balance was in some ways magnified, I think, for them because other arrangements or family coming in to help. And we certainly recognize that and we appreciate that, some of the toll there. Certainly in the beginning, before a vaccine became available, you were always worried that you were going to catch it and bring something home. I don't have to, belabor some of the other things there where constantly being on guard did add to the stress of the job. Our call volume that first year of COVID kind of went down, but carrying out every single call had a greater, you had to be more careful on every call, right? Because you were dressing up more, in the beginning you were gowns, masks, everything. And, in the end it was mostly masks and gloves, but we had face shields, we had a lot of things in the beginning. So it did add a degree of difficulty to every call, whether it was a car accident, heart attack, or somebody, even trauma, you didn't know who was potentially infectious. Having said that, I think as most people, as we're coming out of COVID, was sort of starting to take that a little bit in stride. I think what we saw in the beginning of it, we did get some people who did retire who might have stayed on a couple more years, but maybe they, for personal reasons, they didn't want to risk bringing something home inadvertently, or they just decided that maybe that was a good time to step back. However, a lot of our people really stepped up, and we had some people that were doing double shifts a couple of times a week, just to make up for it. What we tried to do during that was all through that, we expanded our health and wellness here, monitoring every patient. When DPH would track wherever new positives were found, we would get that transmitted back to us from public health. We would check that against our records of patients who we transported so that we would make sure that our employees had used proper precautions. And if not, in the beginning, sometimes we'd pull them for their own safety just to make sure they didn't convert. But, as vaccine became available and different things, we were able to relax a little bit from that. But we hired a full-time nurse as well as our medical director, and to help monitor our own persons here. We had testing available, testing on demand, PCR testing. We could follow up. We would hand deliver. We would check on our members at home if need be. We always tried to show them that support. Now, with some of the other stresses that come out of that, we've increased the size of our peer support team. We've done more training there. They've done more training. We've increased the number of people who are actually detailed to it by one more. We have a young woman who just started a couple weeks ago, who got transferred into that unit, so we have better coverage on all of our shifts. We did a bit of telemedicine during that with our own members who could then call in. And that was pretty successful to the point where some people actually like that, the convenience of doing that rather than making appointments. So we really redoubled our efforts in that area. We've also tried to work on the physical wellness as well, which kind of goes hand in hand with it. We got a partnership going with a few organizations. We have like a runners group now. We have a person who works with the recruits mostly, but also we do things with the Phoenix, the fitness club up there, where that's free for any of us to use, and they encourage us to do that. So we're trying to stay on top of that, and because we want people to stay, we want them to be healthy, and we want them to be healthy and happy and retire 32 years from now. That's our goal. You know, not just to rent them for a couple of years.
Thank you, Chief. Madam Chair, am I out of time, or do I have time for one more question?
You have a couple minutes.
Okay, thank you, Madam Chair. Thank you, Chief. And to Chief Benford, I know I'm looking forward to visiting tomorrow with other councilors as well. Chief, I highlighted in my opening statement, and if you want to talk about it tomorrow, we can, or offline, but just wanted to ask you, are we prepared? If there was an emergency, are we able to effectively evacuate persons with disabilities, residents and living in public housing? Do we have a plan to get people safely from their homes to a safer location if any type of disaster or emergency occurred?
Thank you for the question, Mr. President. So the answer is yes, we do have a plan. We can strengthen that plan, which is really the work that we're doing now. I think one of the areas that we looked at, which was a pretty big gap that we had identified internally, was we hadn't properly taken into account our large contingent of hospitals that we have in the space in our city, as well as the college and academic higher ed community here. While both of those respective entities have substantial resources to support an evacuation, they nonetheless will rely on city resources to help assist and coordinate. So we were able to identify some resources last year that helped us to look at and get a better snapshot of what those institutions and the impact that they would have on our plan. We're now in a position with these tabletops that we did this year to now move to the next phase. And as I mentioned, technology as well as traditional signage is probably a model that we see moving forward that's going to be most effective to really speak to the reality that we have now. And we just concluded those tabletop exercises in late May last week, and we are going to be moving into those conversations over the summer to help strengthen that plan. So we do have a plan, but we're admittedly working to strengthen that because we want it to be the most effective, and I do look forward to that being part of our presentation tomorrow, Mr. President.
Thank you, Chief, and thank you, Madam Chair, for giving me an extra minute.
Finished right on time, Council President Flynn. Thank you. Councilor Lujan, you have the floor.
Thank you, Madam Chair, and thank you again to the chiefs for your presentation. My first question is for Chief Benford regarding the new arrivals. You're talking about the work that your office has done. Hoping if you could expand a little bit more on how your office is interacting with our new arrivals, how you're helping to prepare the city, and potentially what resources can we be activating that we're not activating? How can we be, doing better in that space of making sure that we are welcoming and adequately responding in the way that we want to a humanitarian crisis that we're seeing play out here in the city of Boston?
Sorry, there we go. Councilor Lujan, thank you very much for the question, and thank you for your work and your advocacy in this space. I know that you have been very active in this space, as well as all of the city councilors, in ensuring, most importantly, that those that seek refuge in our city are received in a dignified way that enables them to receive services while they transition at this pivotal point in their life. For OEM, we worked across city departments to adopt our humanitarian plan. And what that humanitarian plan really allowed us to do, it really allowed us to develop a contingency sheltering and response option if by chance the state had reached capacity and we had to house these individuals. I want to preface and underscore receiving and treating these individuals in a dignified way. So that plan was extremely critical. We all recognize, and again, I know that you've been on countless calls with the lieutenant governor and otherwise, and really calling and advocating for the state to step up in a more substantial way, as the state, state statute requires, and says that we are a right to shelter state, and we need the state to be more proactive in that space. And while frustrating on the front end, I think with the advocacy of the mayor, the administration, you and others, I think the state has substantively stepped forward, but we have a long way to go. I do believe that we have a system that is working now that includes not just OEM, but it includes the B&D and housing stability. It includes neighborhood services and a host of other providers within the city to deliver those services. What I can share is so that we better understood how it was that we were going to craft plans and really help to be informed through lived experience. I responded to one of the hotels when they were moving families from BMC over to Revere. And I will tell you, I've seen a lot of things over my career. It was extremely heartening to watch individuals show up in Ubers after walking, in some instances, across countries and arriving in a new country, not speaking the language, not knowing where to go. And the example that I point to, which really underscores why we have to do better, and very proud of the work being led by Yusufi and others in this space, was we have individuals that pulled up just like you and I would on vacation, got out of the vehicle and walked up to the front desk, not speaking the language. They had nowhere to go, didn't know what to do. And we immediately stepped in to help them. I carried bags with my physical hands. I got them sandwiches. I communicated, while working with Language Access and John Romano and Chief Malore's team, and really looking to humanize and dignify parents with children in a way that tried to return some of that dignity while in the moment and assisting those families. So I think that we have a plan in the city that has been working, but it is stressed. It is at the limits. We can certainly use the continued advocacy of your office as well as the other counselors in a unified way. We have heard from others, in other parts of the country, parts of the government, particularly the federal government, and they're really looking for us to speak in alignment, right? We don't want to have one entity of government speaking one direction and we're going the other direction while we're trying to procure critical resources to support our mission. It is certainly beyond the capacity of the city. We know that we need to have partnerships with all forms of government as well as our NGO partners to help us work through it. Specifically for OEM, we do have that plan. We're ready to stand up a shelter if we have to. It is a last option. Shelters are very difficult and very challenging for any family to have to reside in. So we're always looking to identify ways that are more familial in nature, so that these individuals can work through this transition again in a dignified way, until they have more permanent housing and or arrangements. But we do have what we believe to be a solid plan as we work through, and we meet twice a week with the mayor's office at 8:30 in the morning to ensure that we have the most recent and relevant data to act and form our actions off.
Okay, that's incredible. Thank you, Chief. You did mention that right now the system seems stressed, and I understand that as well. I'm wondering if from your vantage point on these weekly calls, from what you see when you're responding to those who are showing up at hospitals, transitioning to hotels, there's the state that has a responsibility as a right to shelter state to ensure that our families have shelter at night. Are there gaps that exist? I'm wondering if you were seeing, if there are ways that we on the city level, if there are areas for improvement in terms of how we're responding, what specifically how can we do better?
Yeah, I think that the big areas, and this is really Chief Dillon and her team leading this space, but the big area that we have had issues with is A, capacity, B, an appropriate intake system, and then C, ensuring that we have the appropriate support systems around meals, around medical treatment to be able to support these families. We've seen city resources that have gone outside the city to support in this space. So those big gapping areas is really around capacity. We're meeting the need with food and nourishment. But it is a stress when we have limited city resources that are really stepping into that state space to support them, where in some instances they've gone as far away as Taunton to be able to support these families.
Or New Bedford, or even further, Fall River. We're seeing people go far. I asked this question because me in my office, since we've been working a lot in this space, I've been thinking, like, what is the best way forward? And thinking about whether it's an office or an FTE, a position that's created that's devoted to resettlement, to helping those who are coming here, because there is a capacity issue. I know on weekends, I often find myself calling Danielle Johnson in the Office of Housing Stability to help with families who have just arrived. So wondering if you think that could be a solution to, if we have one person in-house, or two people rather, who are part of an office or create their own office, who are really focused on resettlement and responding to this issue.
Yes, the answer is yes. And we have started to have that conversation because what we know, right, is we all have other primary duties, but again,
exactly.
We're going to do the right thing. But over time, where we know this is sustained and it's going to be with us for a while, we don't know what that ultimate capacity is going to look like. But nonetheless, it's requiring direct attention now, which is drawing away from those other areas that we should be focusing in. So we have pivoted in the last 2 weeks with laser focus on, particularly as we work through this budget process, and it's really being led through the mayor's office, Yusufy, the deputy chief of staff, on what does a staffing request look like? How do we identify resources that account for individual or individuals that can keep a broad sight picture and engage the conversation, one, and then two, someone to help organize what our response and what our role is. So I can say that we are having those conversations.
Great. Right. Thank you. And like I see Andrew on here, I want to give a credit to your staff and the work that they've been doing. Chief Hooley, I'm not sure if EMS, we haven't connected on this issue. Not sure if EMS has dealt. Would love to have some insight from you. And then just a follow-up, well, related, we talked about emergency relief services for families dealing with disasters and fires, thinking about what the role is for OEM in there in a more proactive way. But Chief Hooley, wanted to, again, extend my thanks and grace to you for all the work that you do. Not sure how you or EMS is interacting with new arrivals, but wanted to give you the opportunity.
Good afternoon, Council. Yes. Well, sometimes we may not even realize, right, somebody's a new arrival, and to the point where we're called to somewhere, and somebody shows up at substation or somewhere else. But on the other hand, we have done some preparatory work with the city and for when they anticipated a couple of times that they may get an influx greater than resources they have available. Like right now, a lot of, as Chief Benford could explain, a lot of people wind up at BMC and they wind up in waiting rooms, what have you. And that was kind of what's going on over the winter. But when, particularly when when that thing was expiring down the border, and they were
Out of 42.
Thank you. When they were starting to anticipate more and more, and that more people were arriving here, some contingencies were going to be like, where else could we set up even just emergency reception sites where they don't have any kind of medical screening? Like, would we be able to assist with that? We've certainly done that when there's been large fires in areas, or if there's been maybe threats of a chemical spill or something released in a neighborhood, where we, as part of our special operations, we help to set up medically staffed shelter. I can even remember going back years ago in the 90s when we had floods in the Archdale development, housing development. They set up a gymnasium over there. We kept some personnel on scene to help with a few different things. In a case like that too, we try to look on our roster to see what what personnel we have working there to see what language capabilities we have. For example, we have somebody who speaks Haitian Creole. We have somebody, we have Spanish speakers every shift. If we have somebody that we can either, reassign or whatever to use for that. So we try to look strategically at that. But obviously the thing is there's only so much we can do at some of those sites is maybe just to try to determine if there's an urgent medical need, like if somebody's blood pressure off the charts because they've traveled and they don't have their medicine, or if somebody who is diabetic or they need treatment for asthma. We can initiate the treatment, get them to the hospital, and try to help get that follow-up care that they need. So that's we are baked into that plan, and we had it on the shelf. We thought we might have to put it into effect just a couple of weekends ago, but it didn't happen. But we were all Yusufi had us all sort of standing by waiting for it.
Thank you, Chief Woolley. I feel like, Madam Chair, is my time up?
So Jen, it's been 10 minutes. I'd say wrap it up with your last question.
Chief Benford, with respect to the question about disaster relief services and how sort of, when we're helping families who are experiencing natural disasters, primarily a fire, but I'm also thinking about water main bursts and things of that nature. We talked about this a bit earlier, but like the role that the city can play, also like maybe having an employee working with private industry that wants to help support our families who are experiencing disasters, or any sort of insight or perspective that you have from OEM. I know we had the hearing about relief services, about how we can help our residents individually after they experience a disaster, if there are ways that you think that we could increase the material support that we're able to offer.
Thanks again for the question. So I'll point to two things in the response. I will say that the American Red Cross has been a consistent and reliable partner. They are a consistent partner of the fire department in their initial response up to a certain threshold in the number of victims, just using the fire as the example. They are able to support, and then beyond that, we typically will tap into the Red Cross. They have been a tremendous partner and have answered the call each and every time. One of the gap areas that we've identified in their mission, it specifically deals with natural disaster, and fire counts as one, but very interesting, a water line break in a building, which results in water damage at the units below. It doesn't necessarily qualify in that space under the mission. So we have seen gray areas there. We have talked, and we did do a tabletop exercise here at the EOC to have and to talk about those different realities that we're dealing with. What we know is we've seen it over in Alston. We had a 1-inch water main break, water line that broke about 2 years ago. It subsequently took about 100 units offline from a 1-inch line. The American Red Cross, because of our relationships, did respond and did assist, although it was outside of their traditional response area. So we did have to rely on city services to support primarily in that space because it was outside their mission mandate. So we were able to bring in ONS as well as other city partners to meet the moment again and be able to support those families in their time. But we have ran that tabletop. There are different opportunities for us to learn from that. We are also engaged in conversation now with Water and Sewer as well as ONS to better understand how we can rely on and leverage Boston Water and Sewer Commission resources and what their role is when we have those breaks. And I don't have my schedule pulled up, but I do believe that meeting and that conversation is scheduled for this week. They were doing some research on their side to find out what other resources there wasn't asked from the administration to better understand that and find out how they can better support. So I think that there was a broad base acknowledgement that there are opportunities where we can again leverage their resources to help further support those impacted and affected by it, because it's a gigantic gray area. They do come out, they do the response. I don't want to speak for them, but we can do better, and I will acknowledge that they have agreed to come to the table. We hope to have that follow-up this week.
Thank you. I hope that's a productive meeting, because they a lot of times I felt that they've fallen short in terms of helping our
Thank
families
you,
and our residents. So
Councilor
thank you.
Lushan. Thank you so much. Sorry, we are short on time, and considering we may not have time for a second round of questions, but we have at least 4 councilors left, so I'd say 10 minutes each, and then with closing statements. Councilor Coletta, are you still with us? I see you here. Councilor Coletta?
I am, Madam Chair. Thank you so much. I do want to recognize
I
to your
apologize.
discretion, Councilor Braden was in front of me.
Yeah, right. Thank you. Councilor Braden?
Thank you, Councillor Coletta. Thank you. Thank you, everyone, for your presentation. A few quick questions.
Yeah.
You got it. Heat emergencies. The Alston Jackson Man Community Centre is our FEMA emergency centre, and it is slated to close. The community centre is still ticking over there, but I think its time is limited. Do we have? I think the biggest challenge is heat emergencies. Not so much cold, but heat is definitely an issue. Do we have a plan for setting up an emergency centre, a FEMA emergency centre in another location when the community centre closes? That's one question. And then there was a question for Chief Hooley about advanced life support ambulances. Are we still reliant on them coming from Beth Israel? Is that the nearest advanced life support ambulance? And how many trucks do we have, located in Alston Brighton, and what sort of demand is there for those services in relation to the number of calls that you respond to? I know, Chief Hooley, we talk about EMS stations frequently, especially as we're trying to get one built at St. Elizabeth's. Fingers crossed that's going to happen, but, fingers crossed. The other issue is that the present location you have in North Alston is going to be developed, and you're going to go to a temporary location in the meantime. So I'm thinking we need to get our heads together as a city and think about, co-locating a new emergency services centre in North Alston, Brighton. That's where all the development is happening. We have a population of 80,000 right now, and we will probably hit 95,000 in the next 10 years. So I'm just thinking, rather than trying to retrofit these things afterwards, when it's all built out, we need to be really proactive. At least making a plan to get this conversation rolling. So those were the 3 big issues, really, just response times, long-term strategic planning for emergency services in Alston Brighton with a growing population, and then how we respond to heat emergencies, and access to cooling centres in Alston Brighton. Who wants to start?
Jim, do you want to take the first one, or do you want me to?
Yeah, I guess, sure. Okay. Good afternoon, Council. Good to see you again. Anyway, let me see. So let me start off with just some of the first one. Yeah, currently we do like Paramedic 16, which is housed on Brookline Ave over by the on the campus of Beth Israel, is the first ALS truck that would be available for Brighton, and then other ones would be like Paramedic 1 from downtown, or Paramedic 5 coming across from Jamaica Plain. We currently have 5 scheduled on days, evenings, and ALS trucks, and we certainly could be looking at expanding the number of the advanced life support units across the city as well. As far as the BLS the coverage that we have in Brighton, right now we're utilizing 2 ambulances, ambulance 14, ambulance 9, ambulance 14 is 24 hours, ambulance 9 is a 16 hours. They go down on the night shift. Unless sometimes we'll put them up during storms or if we anticipate something's up, road closures, what have you. We're looking at all of our neighborhoods numbers wise. And as you mentioned, as far as even the long range planning, I know BPDA has been looking at different city sections. For example, Charlestown, like say, what are your current capacity and needs versus what do you think you might need 5 or 10 years from now? And what do you think we might need for either stations or planning? So we're going through that exercise right now so that we can try to meet it. As I mentioned earlier, we are looking to grow the department, get more people on with the number of vacancies we have right now. I think we're down about 48 positions. Obviously that's not taking into account what we hope to gain with this recruiting and putting a couple of classes on between now and this time next year. Hopefully we'll be able to start to close that gap. The more crews that we're able to put on and schedule regular, then the better chance that we can either create and deploy more ALS trucks, but also more district trucks to cover different parts of the city. Yes, haven't heard anything back from St. E's since they got their approval by BPDA for them to build their large parking garage. One of the contingency, one of the biggest community mitigation thing they got on that was to construct a 2-bay facility for us on their campus there. But I haven't seen the construction starting or anything, so kind of waiting to hear back on that. Harvard has given us notice that they do plan to raise and rebuild the building that we're currently renting from them over on off of Western Avenue for the 2 ambulances that we do have in Brighton. Although they've told us that they are committed to keeping the ambulances in Brighton and that would be uninterrupted. We're already scheduling a meeting coming in with square footage assessments for them. They still have one parcel about 100 yards from where we are now, only about 100 yards away, that was a body shop. It's abandoned. That they've made some commitments already that they will remodel that as a swing space or as a temporary space so that we can maintain presence. So we're not even out of there for a day before they take down the building that we're in, because we're the only ones left in the building that we're in now. Stadium Auto Body's gone. The Joel Smith Health Center's gone, and they're looking to construct some other site there, but they said that they would also maintain space for us out there, that they feel that that's something that they'll Brighton. But that'll go through the, what they call it, Article 80, that'll go through that with BPDA as well. I'll let you know, well, obviously, when that meeting's going to take place. But at the coffee hour last week, a few representatives from them made sure to come up and let us know that. One of them said, and you'd probably agree, Council, that they said if you asked the people in Alston and Brighton, hey, where do your ambulances come from? They probably couldn't answer it, 85% of them. They said, but if those ambulances aren't in Brighton or in Alston, he said, you'll be damn sure they're going to know about it in 5 minutes. He says they'll all know about it. So Harvard's very aware of that. And so that's good. I think they've been pretty supportive. On the What else? Oh, and just by way that one of the things we try to do even now, in the meantime, like when Boston Calling was going on, the 3-day music festival, the last couple of days, we had one particularly warm day on Sunday, but Saturday was busiest because they had, I think, 47,000 tickets sold for that day between it all. But the 3-day festival there, because we did impress upon the organizers and them over there that we had to have a presence over there. We had 4 medical stations set up. We had two of our physicians with us over there, so we could do more treat and release from the sites. A couple of ambulances, carts. We recorded 591 patient encounters, anything from Band-Aids to heat strokes to allergic reactions. And we transported 21 people to the hospital. Now, and we did that almost solely without impacting any units from Brighton. There was 1 or 2 days when it got real busy. We had to make a request for A9 or 14 to come in to help us. But for the most part, we did that with the detail units on scene. So that's one thing we really try to do is when events are happening in Brighton or anywhere in the city, we really try to hope that we're not trying to fill details because people want to work details, they want detail pay. We try to do it so we're not pulling ambulances out of neighborhoods to come into your road race, your festival, whatever you're sponsoring. And so that was pretty successful for a big crowd to be able to do that. So I just want to let you know that, and they listened to us. A couple of years ago, they tried to cut down the size of our detail over there. And we told them that it was a recipe for disaster. And, fortunately, they listened to us.
Good.
And for the same way with the run. Same way with the run. I'm sorry. Go ahead.
I was going to say your time is up, but Council Braden, please close your final remarks.
The question I had about the heat, the community center emergency, FEMA emergency center at also the Jackson Man Community Center. Do we have a plan for where that's going to be stood up when that's closed?
Sure, I can answer in 10 seconds, ma'am. So obviously, the Jackson Man will be available this summer. The Emergency Heat Task Force met today, and we talked about those locations moving forward. We are looking to ensure that there is a location in each neighborhood. I know you've been a tireless advocate to ensure that they're represented out there. So I can assure you that it is part of the conversation so that neighborhood isn't left out. Fortunately, we have the Jackson Man for this summer, and the team and the task force is actively talking about replacement locations once that comes offline.
Very good. Thank you. Thank you. Thank you both. And thank you, Madam Chair.
Thank you, Councilor Braden. Councilor Coletta, you have the floor.
Thank you, Madam Chair. And I will try to be very fast with my questioning because I do have a lot, and I'll just ask respectfully that folks with their answers can be quick as well. But I do just want to thank the brave men and women of EMS. During the pandemic, they served thousands of folks with compassion and kindness, one of them being my mother, Nina, during the early days of the pandemic, who remarked that the ambulance staff was very reassuring during one of the scariest moments of her life. So I just want to say thank you again. And I will always keep saying thank you for that because it was really scary. So I will start with a semi-capital question first regarding the needs of my district. ESD was pleased to obtain the second bay in the airport to solely serve Massport. And this helped with response times in all of East Boston, which is great. And Chief, you mentioned Charlestown earlier, and you and I had a brief conversation at the coffee hour about the facility needs for Charlestown. Would you be able to discuss what the next steps are to get those bays up and running and any knowledge that you'd like to put on the record?
Afternoon, Councilor. Yes, happy to. Well, first for East Boston, no, we were desperate to add that second ambulance over there a couple of years ago. And the biggest problem we had was we didn't have another garage over in Eastie. And there had been a plan and I had seen this going back to the late 90s to site, an ambulance bay at East Eagle Square over by where the new police station was going in, that a public works facility. I know because of, the pressure to get the BPD out of their old station, that their needs took priority. So I'm still not, I haven't heard much of an update on that development by the city. Massport, agreed to help out with the city. They constructed that second bay for us over in East Boston on Prescott Street. And it is for the city. What we try to do is we try not to let two ambulances sit the same. We try to get one down towards either Central Square or somewhere else, or go up by the Heights, depending what traffic and conditions are, so that we have some coverage across East Boston. On the Charlestown situation, currently we have a single ambulance 15, 24 hours, that's located in Sullivan Square in a building that was a temporary structure that was built for the Central Artery North project, which predates the Ted Williams, even predates I-93. That building was designed to maybe last 10 years. I think it's probably has 30 years on it now. It's a single bay. There's been a lot of pressure to develop Sullivan Square, and it's a private developer that wants to build on a land that was owned by BPDA, and I don't want to mess up on this, but it was 2 phases, and part of the development there is that, again, if the successful bidder to develop that site, who's working with community resources and with BPDA, their plans have to include a 2-bay, because if you give us 2 bays, we'll fill it. We'll put trucks there. We'll put crews in it. In Charlestown. And one of the things we told them was that, and it can't be like we all relocate us for 6 months to a year until you do it, because we can't have an interruption of services over there. It's too far to shift change a truck out of Shirley Street in Roxbury to travel back and forth to Charlestown.
100%. And just to chime in, I appreciate your answer. There was an incident recently in Charlestown where an elderly woman was in need of assistance following a medical emergency, and Boston Fire arrived 15 minutes after, but EMS arrived about an hour after they were dispatched. And they were coming from a different neighborhood because they were occupied with a different call. And so I just think that this incident highlights the necessity, and similar to Councillor Braden's question, just assessing what the holistic planning looks like as the city grows. Mayor Wu is calling for all of us to reach our peak population back up to 800,000. And so that means that we have to grow by 150,000. And my district in particular, with Suffolk Downs and all of the development that's occurring in Sullivan Square, I tried to take notes during your presentation, and I'm sorry that I missed the first slide talking about personnel. How many personnel are we anticipating to hire, and how does this budget reflect that? And then thinking about all this moving forward, what is the ideal ratio of residents to ambulance bays, I guess, and how are we building up towards those benchmarks while we grow as a city?
Okay. Yeah. In the beginning, in this budget, we gained 10 more positions. 5 were non-uniform, but 5 are uniform. Last year, the city, all of you, approved us to increase by 20 our total FTE count. Unfortunately, we with some of the retirements and some of the folks who moved on to either go nursing, go PA, or we had some folks that left to go to suburban fire departments where they like the idea of working 8 24-hour shifts in a month. That's kind of hard to do in an urban EMS system. But so we lost some bodies. trying to play catch up on that. Like I said, we're down about 48 right now, which would be inclusive of the 20 that you gave us this year. I think had we filled all those this past year, I think I would have been in a better position to make the pitch for even more than an additional 5 uniform this year. I think what we're going to try to demonstrate is that we can close that gap, bring on these personnel, so we can put extra units on. Even if right now, if there's zone impact trucks, like to bring an extra truck on that could help cover an extra truck for Charlestown, an extra truck, even expand East Boston to like 24 for the second truck. Same with ways for Brighton. West Roxbury has been call volume's been picking up there. After that used to average 11 calls in a 24-hour period 10 years ago, but now that's about doubled. So as far as the metrics go, we look like where we're getting the calls, and some are clustered around transportation areas, and some are, for example, like in downtown. Sometimes more of the calls, as you get more high rises, the response times vertical. They're not just going to single families like they could be in Hyde Park or multi-families like in Dorchester and Mattapan. But we tried to look at call volume by hour of the day and by distribution across the city. Another thing that does impact us, though, and is where the hospitals are. Because if you are transporting patients from East Boston or Charlestown, there's no hospital in either one of those locations. So you're either going to Mass General, to Tufts, BMC, you could go Longwood. And in some cases, hey, if the person's a veteran and they're stable enough, then God bless them. We're going to take them out to West Rocks VA because they're entitled to go there. So our thing then is then travel time back. So what we need to do is keep adding. We call them zone impact trucks so they can help fill in. We did that a few years ago, so that when some of these other trucks downtown or in outlying areas get busy, we can shift resources around. Because sometimes it's kind of hard to predict what the next call is going to be. But we're going to do some of that modeling. We have folks from MIT that have been pretty good to help us with studies like that. And we'd love to be able to hand over a plan for like where we see Boston in 2030, or where we see our needs coming forward. MIH will help shift some of the transports off to hospitals if we're able to get them somewhere else. But it's still going to move up. But we're still going to need our human beings, our EMT call takers, our EMTs maybe on the scene or in specialized units, screening the person to make sure it's appropriate and getting them there.
Yeah. And from what I'm hearing, just when it comes to the personnel, is that we are struggling to retain folks and recruit folks, which is a consistent theme across all of these budget hearings. So I appreciate that, and I appreciate your answer. And Councillor Fernandez-Anderson, how am I doing with time?
Councilor Coletta, you are done with time.
Okay. Thank you all so much for your service and for being here and answering our questions. Thank you.
Councilor Flaherty, you have the floor.
Thank you, Madam Chair. I'll pick up Maureen on the nutrition.
Councilor Flaherty, do you think you could adjust your... Councilor Flaherty, we're having a hard time hearing you. Your words are not making out.
Maybe it's a little better, Madam Chair.
A little better, yes.
That's a little better. So, Chief, just want to, as you recall, I led efforts on the council with 4 years ago, which would have thought that would have solved it. Seems like there may be a burnout factor that we're experiencing with some of the public safety departments, as well as our 911 operators. We get what it's do moving forward to make sure that are very well-trained and experienced, one of the best in the country EMS divisions, as well as our 9 ops seem to be able to hold on to as well. And then want to make sure
We lost Council Flaherty. Let's give him a second. Council Flaherty, are you back with us?
lose me again, Madam Chair.
I lost you. Could you repeat your question again?
We were talking about attrition. Initially, we talked about doing the best we can, not just with our EMTs, EMS, but also our 911 operators. Want to see what's being done on that front, given that Group 4 for our EMS, I thought that would solve it, but it seems like there may be a burnout factor. And then also want to talk about the response times. What are our response times now? I had concerns as pre-pandemic with traffic levels and our increase in population, as well as the traffic around the city, slowing our times down. Then the pandemic hits. That did not seem to be a problem. Are we starting to see an uptick now as things are starting to get back to normal? And are our response times suffering at all? And if so, what can we do to increase those numbers? So, thank you, Chief.
No, thank you, Council. I was able to get most of it, but thanks for clearing up the thing at the end there. Let me see. The first one on the, certainly the Group 4 did help because we have a lot of people that are actually making it to the 32 something years. And that's part of it. So we're losing some, longstanding veterans. But, I'm hopeful that if we're able to add to the workforce now with the numbers that we have, if we're able to bring more people on to address these 48 vacancies that we have right now over this next 12 months, that will have a positive impact and effect on us because the folks that are doing the work, they're doing a great job. But, we are currently having to rely on, mandating them up to 2 times a month to stay beyond their shift and do another shift. And I think if they see that there's some light at the end of the tunnel that we are getting help in, that may also help us to retain some people. Certainly hopefully the latest collective bargaining thing will also address some of the other things there with longevity and investments and insight. That's what I'm looking for. Anyway, some things to address longevity, even starting at 5 years into the job, and a few other things. So I'm really hopeful that will help along with the Group 4 for us to retain people. And then once we get to that, then it'll be easier for us to even make a pitch to expand beyond that. Because I think that's where we fell a little bit short, was trying to explain why we needed more if I couldn't fill what I have right now. So that's a challenge, and it's a challenge I think we're gonna meet. We're working on it. We're trying to even make EMTs in this city. We're not going to wait for them to come to apply to us. As far as the response times, yes, our call volume's going up. Our turnaround times at hospitals have gone up a little bit too, because of the impact that all of this has had on the hospitals. They're all, I wouldn't say they're all swamped every day, but pretty close to it. There's a lot of stories about hospitals having extended, people having extended stays in emergency rooms, people waiting 12, 24, 36 hours for beds upstairs. So you get people boarding in emergency rooms. And there is a little bit of a crisis in emergency healthcare. Certainly, it's not as bad here as it is in some other parts of the country that I hear about, that I read about. But we don't want to wait to get to that. So we are trying to see what we can do to improve it. Traffic, and which is returned, right? Because everyone's back to work and back out. Those are all factors as well too. But what we try to do is really prioritize the persons most at risk. The sickest person is the highest priority call, gets the resource first. Then the next level, and then the next level. But also for the higher priority, and even for the medium priority, if there's going to be any kind of delay, in many of those calls, we have other first response going as well, Boston Fire, Boston Police, if need be. But we're going, I can provide you with breakdowns on response times by priority and districts to the council.
That'd be great. Thank you, Chief. Thank you, Madam Chair.
Thank you, Council Flaherty. Councilor Mejia, you have the floor.
Thank you, Councilor Anderson, and thank you to the administration. Have been listening in and really do appreciate the questions that my colleagues have asked, many of which was on my to-dos, but appreciate the responses. I would just, because I want to be super mindful of time, would like to lean in on two very specific issues that I always bring up in every of the hearings that I've been, is really looking at your diversity. Chief Hooley in particular, in terms of like kind of what success looks like for you. I know that you have, over the last few years, have done an amazing job at increasing the leadership of color within the ranks, but I'm just curious, kind of like, how are we continuing to move that along, and what can we do on the council to help support you in that effort? And then in regards to emergency management, I'm really curious about the work that mutual aid groups have done, in terms of, we see those mutual aid groups as just as separate, but in many cities, mutual aid groups are part of the emergency management response and do play a role in supporting the relief efforts. And it's not just shelter, it involves shelter, it involves dealing with crisis. So I'm just curious about mutual aid groups and what, if any, opportunities exist to better align ourselves with some of the efforts that they are still doing post-COVID, in terms of supporting people who are in crisis, looking at the new recent arrivals and the role that mutual aid groups are playing and connecting people to services. So just curious about what your vision is for a more meaningful engagement with mutual aid groups that are on the ground, oftentimes the frontline workers, many of which who are doing this on a volunteer basis. So those are the two questions, considering the time, that I'd love to be able to unpack in my time with you all. Thank you.
Councilor Mejia, could I just ask, when you use the term mutual aid groups, are you referring to NGOs and neighborhood-based institutions that are willing to partner to support these families in that space?
It's a combination. Some are already established nonprofits. Some are volunteer groups that are operating very loosely without real formal leadership, but oftentimes are, crowdsourcing their network to help respond and to provide shelter or cover or whatever crisis management. But and you may think that this might be something that goes under housing, but I am curious, as we start looking at recent arrivals and the role that we play from an emergency standpoint, what role, if any, could some of these groups play in supporting your efforts, if any? And I'm making assumptions here, but I don't know if you've given that some consideration.
No, thank you very much for the question. I greatly appreciate it. I think it ties certainly directly into the early line of question from your colleague, Councilor Louisine, with regards to how and what's being done and how can the council be supported. I think you're right. We've seen a number of different organizations that provide a range of different services that have availed themselves to help in this space. I do think that from a city standpoint, identifying staff that's specifically charged to sort of oversee, really manage the response is the appropriate next steps. For emergency management, we're going to coordinate however we can certainly help with drafting a plan where those respective stakeholders the plan, but I do think we have to do it in a methodical and intentional way to ensure that we're vetting groups and ensuring that they're meeting the needs of the families that are coming in. So I do look at, and I have advocated a station where we talked about staffing so that we could have someone that specifically comes in to set eyes on so that we understand policy, understand range of services, how best to embed them into the plan. So OEM would sort of help assist and manage the plan. But there would be other individuals that would step in and assist with how we vet and how we partner with others. There is several groups, and the name eludes me, but they're well-known Haitian doctor, female doctor, that does tremendous work in this space, extremely well-informed. I know that she is highly consulted, and I envision that you're thinking and talking about groups like hers, and they need to be part of it so that can best understand little things like culturally appropriate food, the respective individuals that are coming in. How do we make sure that we're engaging and supporting them in a way that they're used to, a way that is sensitive for them? So I think that there is a role. I would directly tie it to the broader planning long term with those individual staffers that are going to come in to help manage the overall response.
Thank you. Thank you. And I want to be super mindful of time. Chief Hooley, if you could just talk to me a little bit about the recruitment and retention and efforts to continue to build the pipeline for people of color to move up the ranks. And I'm sorry I'm not on camera. I just have allergies and I'm just sneezing away here, and I just don't want to disrupt your your vision. Thank you.
No worries.
No worries. Hope you feel better. Good afternoon, Councilman here. Let me see. I'll try to make it quick. As far as the strategy overall is to get more persons in, and as we do more hiring, we have an opportunity now because we have, like I said, close to 48 vacancies, and hopefully. Well, not hopefully more vacancies, but hopefully success in that will lead us to be able to even put in for even more positions because our call volumes do keep going up and the demands and service with that. Getting, starting from recruits on up, as we get persons in, as we do a better job recruiting there, specifically from like a lot of the neighborhoods where we've had some success the last couple of years, getting more and more native Cape Verdean Creole speakers who come on to work for us, EMTs, who then maybe attract either family or friends or somebody else to come in to follow them. Same as whether it's a lot of the native Spanish speakers that we have who before it was mostly Puerto Rico, but now we see a lot of people from Central America, South America now starting to on some of the applications and on some of our classes. We've had certainly success from the Haitian American as well too. As we bring people in, then all of our promotions then are usually interim. So we then promote, with the exams, up to some other ones where the management ones, we're not reliant on so much on the contractual language, but we have the ability there to grab, but to get more people who have developed in in a short number of years here. So to get that pipeline going and people coming in, I think it's going to be our fastest track. Like right now, I know on our, I think like 35% of our workforce is female, but 38% of them are in the EMT rank right now because that's the ones that have started, where we have the biggest concentration of people maybe 12 years or younger on the job. But if you contrast that to deputy superintendent, which is a community rank that oversees the majority of our personnel, which includes shift commanders and different deputies. Now we only have 11, but 6 out of 8 of those positions are persons of color. So, I mean, that winds up being our most diverse rank. Along the way, we do better or worse in some other ones. As I mentioned earlier, with the scholarship and help for our members here, USEP's helped us to get more candidates of color now to take up paramedic training, so they were able to sit for the qualifying exams here now as well too. So there's no one thing, but there's a lot of things we need to do, and a lot of things that we are doing that we have to keep up and just stay dedicated to. I mentioned it at the council budget breakfast that, hey, a lot of the people we need that bring in the language skills, the cultural capacity, they're here. They're going to school in Boston. They grew up here, or their families moved here, within a generation, and maybe they just never even considered us. But we're trying to get present in more job fairs. Like I said, we've offered 100 scholarships out for people to get trained to become an EMT, and we're working even at the high school level to try to incorporate.
Sorry, Councilor Mejia, is there a reason you have your? Sorry,
Yeah.
Chief Woolley. Councilor Mejia, have your hands up?
Yeah, I just wanted to be mindful of time.
Apologize.
I wanted to, that's okay, Alexa. Or Siri, who's ever there working, your AI assistant there, Councilor Anderson. But I just wanted to just land the plane and just let you know, Chief Hooley, that I really do see and appreciate all of the efforts that are being made and whatever else we can do to help support you all, whether it's more additional funding to help support and offset some of the costs that some of our recruits have to endure. Whatever it is, we're here to help and support, and really do appreciate you and your efforts. And I just want to be mindful of Councilor Anderson and just wrap it up with my questions here. Thank you.
Thank you, Council.
Thank you so much, Councilor Mejia. I think that's about it. So you're the last councilor with us, Councilor Mejia. If you had a final statement or question, happy to take it now.
I just want to know for the record that I should get the special attendance award because I come early and I stay throughout the entire thing. Want to note that for the record. And seriously, just wanted to thank everybody for their hard work, and Councilor Anderson, for you to shepherd us along this process. I'll just be tuning in to listen to your questions just because I want to be informed. So thank you.
Thank you, Councilor Mejia. Yes, and very accurate. You're always here on time, and you do stay through the duration of the hearings. Thank you. Tim, I think my questions are more for you, and we can move this right along and wrap it up, hopefully, within the next 10 minutes. The permanent employees, external funds totals about $1.7 million, while only $416,205 of it was spent. And I know that sometimes it doesn't look as accurate as it should, the current numbers. What is the Office of Emergency Management's plan for utilization of these funds during FY24 cycle? And this is for permanent employees. It was, I guess it looks like it's going to increase, but then because only a certain amount has been spent, and considering the total funds is 1.7 million.
Yeah, thank you very much.
Yeah, go ahead. Go ahead.
I'm sorry. Go ahead, Tim. My apologies. Go ahead, Tim.
No, that's what I was just going to say, Council.
Whomever, sorry, yeah, whomever.
I'll defer to Chief Benford for that. I handle EMS's budget.
Oh, okay. Thank you. Chief Benford?
Yeah, sorry about that. I was hoping Tim was going to take it, but after we picked up on it, thanks, Tim. Thank you for the question. Councilor Anderson, I would defer to the same issues and challenges that many departments are facing with vacancies and turnover. So over the course of the last year, fiscal year particularly, we've had substantial turnover. We're excited to note that we've created pathways for growth internally. So a lot of that institutional knowledge stayed within department, but a lot of that is tied to vacancies as a result of folks moving on. We expect and hope that we're going to be fully staffed this year. And as you aptly picked up on, that's where the majority and the bulk of those funds and resources are. And I would expect that we'd see a much different site picture in FY24.
Thank you. The same question for overtime. The recommended only 57%, about 57.16% of the recommended overtime budget has been spent. And I guess if we're asking for additional funds, then it would appear that up with the FY23 is almost closing. So I guess, is there a discrepancy there, or is it just not accurate?
No, it probably is accurate, ma'am. We didn't, to my knowledge, we didn't ask for any additional funds for this year. The challenge with the overtime is unlike EMS, police and fire, where they have minimum staffings, where those funds, statistically dedicated in those areas, and they pretty much know that they're going to use them. For us, a lot of those funds are really tied to emergency crisis. So if we've, sort of looked at it through the lens of, after the untimely murder and death of George Floyd, we had long operational periods where our numbers would have spiked. This year, we haven't had as many. So that's what that number is. But I do not believe we asked for any more than what we have been afforded in the past, and it should be a maintenance ask.
Thank you. Same Office of Emergency Management. The transportation and travel line item under contractual services for FY23, appropriation was $0, but there was a $2,772 spent. Where were those funds derived from? Are you able?
I'm sorry. Go ahead, ma'am.
Oh, I was going to say, sometimes there are funds where you can tap into, like emergency funds or other sorts, and I was just curious to know where the source of the fund was.
Yeah. So when you look at our budget, it's pretty lean. Considering the size of our department, our operating budget only accounts for 10%. Particularly of our overall management and administration and personnel costs. So we have historically not had a funded travel line. There are several, in the instances where we've had the travel, we have typically derived those funds from contract services. It's really the only place in our budget that has what we've seen to be any flexibility on the back end when we close out budget years, but we have historically not funded that line. Some of the areas that we know that we had to increase was around mass communication and notification. And that's where we saw some surpluses in that contract services. But typically when we fund travel services, it comes out of contract services that we relocate or move funds from.
Thank you. I just want to understand a little bit better about current charges and obligations. It makes up about 27% of the budget, almost equivalent to contractual services, which makes up 25% of the budget. So I just wanted to understand, can you please elaborate in terms of what is included in the current charges and obligations, given that it makes up a large portion of the budget?
I'm sorry, ma'am. Could you give me just a little more clarity on that? I may have missed the front end of it.
Your current charges and obligations makes up 27.2% of your budget, almost equivalent to contractual services. And I guess being that it's a large portion, I just wanted to understand.
Sure.
If you could elaborate, yeah.
So I think that the biggest portion of our budget, and I believe Andrew may still be on the line, who runs admin and finance. The biggest portion of our budget is obviously personnel costs, but it's also the lease. So we have. Yeah. So it's pretty much encumbered. So that, it's, it's an arrangement that goes back some time. BPHC executes the lease, they pay for it, and we reimburse out of our budget. So it generally ends up being dollar for dollar that's reimbursed by the end of the fiscal year.
Thank you so much. Thank you so much to learn, if you just ask, right? Can you give us an update of the Emergency Operations Center and what timeline or complications looks like for this capital project, if you project any?
I don't, we're very fortunate that we have had some conversations with budget as well as PFD and operations that I spoke of earlier, where we know that we have extended the space here. We are co-located here with EMS. Chief Hooley and his team have been extremely cordial in working with us to identify space for us to grow. What we had in a prior iteration, I had a portion of my staff that was at City Hall and a portion of my staff that was here. Our operations are not set up like EMS, fire, or police, where they have districts or station houses. So I wanted our staff to be co-located so that we can maximize and leverage resources. We are pretty much sort of at the seams here. However, we are having very good and productive conversations to include all those stakeholders that I mentioned in terms of looking at additional and new space. As you know, nothing moves at the speed of light. It will take time, but there are some very productive conversations that I have, and you'll see. I believe you're going to join us tomorrow. You'll see that we have some real equity issues here when we talk about gender and release space that needs to be addressed. That we hope and will be addressed in a newer facility. So we're excited about the progress that we're now seeing with the commitments that we have on the table.
Thank you. The most recent hazard mitigation is 2021. Do you expect an updated version for the natural hazard mitigation? The most recent plan was from 2021, and how often do you do them, and do you expect an update?
Yes, so I do believe that I believe it's on a 5-year cycle, so we have to start that in time. So I believe that is going to be coming up. Those are 2 positions that we saw with, but we are happy to report that we now have supervisors and senior management now seated in those positions. And one of the priorities that I just met with that staff on is to set a site picture and a plan for our efforts to update the hazard mitigation plan. But it is, again, I believe it is 2025 that the plan has to be updated. However, work would start in advance of that, and it is a priority that's in front of us to start that work.
I guess considering that the process involves tracking vulnerabilities and risk and natural hazards, where could we find it, especially particularly for disenfranchised communities? Where can I find this information? How is it accessible, and are we making it user friendly so that folks can digest it in a way that they understand it?
Yeah, and I think so that's that equity piece that I mentioned earlier, and wanting to make sure that all of the communities that we speak for and that are going to be impacted by the plan have an opportunity to chime in. And in turn, it gives us an opportunity to inject into the planning process what is helpful for those communities that are going to be most impacted. So we're looking to do that work real time with the updates. That's probably that, along with the evacuation plan, will probably be the next line of substantive plans that are updated, that are going to take into account and include a very deliberate community process so that they can help inform how that plan is. And I do believe, Andrew, are you on?
Yes.
Oh, you may be muted.
You may need a headphone.
Yeah, I'll communicate with him and our planning staff, and I will get that to you. But our plans are publicly disclosed, and I believe they are on one of the city's landing pages. So I will work to get you that info.
Thank you, Chief Hooley. Thank you for staying on this long with us. The Office of EMS website mentions a few programs under community initiatives, such as senior safety presentations. How does the department conduct community outreach to connect senior constituents to these local programs and educational resources?
Center Felicia, right? Community services. Okay, you can hear me now, right?
Yes,
Okay, thank you. Good afternoon, Madam Chair. We have one of our deputy superintendents, Superintendent Felicia Robinson. She's for many years, she does a lot of stuff. She does the car seat safety. She does a lot of the programs. But she had been our principal person for doing outreach with the seniors. Years ago, we started a program with they called it File of Life, back kind of a low tech approach to. There was small little cards that we used to go out to some of the groups, or some, especially developments of homes for or housing, where cards that would you could list medical conditions and you could list medicines, prescriptions, or allergies. Write on them with pencils so they could erase them, change them, because everybody's doses change or new meds, what have you. And they were magnetized, and we'd ask them to like put them in their refrigerator door. And then we used to tell on people to look for that. If you come in, you had somebody who either couldn't speak because they had a stroke or they were unconscious now, or maybe there was a language barrier, you could look for it. Because some EMTs, if you're trying to put a piece of story together, you might go check to see, geez, do they have insulin in the refrigerator or something? So that's where that came from. But on top of that, we started working in different health education information around that, and trying to work with people about, again, whether it's talking about heat emergencies or talking about cold emergencies, talking about what are the services the city offers or somebody else offers to help with that. Similarly, when we did our share of vaccination clinics for COVID, the majority of ours, then when we did it in some of the BHA housing, or we did it in some senior buildings. One, because not that other people wouldn't do it, but we always felt like a lot of those places were really natural constituents for us. You know, we're in those buildings a lot. We get recognized in there, and maybe some of the people might have been more willing to talk with us. And so we're trying to keep that presence up. But we do have an office. But we do have an office here. We do have a deputy here who's dedicated to that.
Thank you, Chief. The enhanced trauma response, there's a dedicated, and I'm not sure if this is overall for FTEs that for the Boston Public Health Commission or specifically for your department, but there's a $200,000 investment for financial impact, specifically to increase 2 FTEs for trauma response. Does that fall under, I got this as a response to my request in the RFIs. Does that fall under your department? Are you getting 2 FTEs? Is there a proposal to get 2 FTEs in your department for trauma response?
No, I don't believe so. I think the additional FTEs we're getting are 5 were uniform and 5 were non-uniform. A lot of the trauma response, I know, is up. Our programs are located up at public health side of the fence. Well, but having said that, we are trying to do a better job incorporating our efforts with them. We always worked very closely with Mark Scott and with Don Lawsgood, and trying to do a learning when we hear of events that happen out there. Yes, they do get notified by the police, but we try to pass on information about patients and what the situation is, try to give them some context, right? So when they're dispatching the trauma response teams, so if we were able to tell them that, hey, this was up by St. Peter's, and it was some of the people involved seem to be more from a Cape Verdean community, maybe that helps them to direct which teams they want to send there. Versus like when we had an incident where a senior gets stabbed down at some senior housing on Alpine Street. They want to incorporate the response here with some people from Age Strong as well as there, so people could talk to the neighbors. So we're trying to get a little better at incorporating ourselves into the, even just to some of the notification there. But also, we realize that this has lasting impact on everybody. And it's a lasting, one on the victims, but on the neighbors, on the kids that go to school in the neighborhood there, on everyone. And like, how do we anticipate that? And how can we play a role in helping with response for that in the weeks, months, even years later? Because we do get a fair amount of calls for maybe for schools, for maybe sometimes some behavioral things. And you come to find out that some of these young folks were witnesses to violence before. Maybe that was, there's a lot of different things there where we could make some strides. And so we're hoping to improve that. But in answer to your question, no, those funds, I do not believe are directed to us.
Okay. Well,
Councilor, if I may, just I think those two.
I'm sorry, Tim.
I wanted to answer your question about those 2 FTEs real quick.
Okay.
Yeah, I do know that they're part of the Health Commission request as part of the neighborhood trauma team. I don't believe that they're part of the FY24 budget just yet, but I know that various folks on the commission are working on that with the mayor's office. But I can provide some more information to you after the fact.
Well, I got it as a response to the FY24 budget proposal or recommendation, and it does say 2 FTEs, $200,000. And I was just wondering, this is the Boston Public Health Commission, what I have in front of me, response to our RFIs, but it did come specifically for EMS, and I guess that it was a response to in terms of any types of budget relating or in connection to EMS. So I'm reading from the documents that I got from Boston Public Health Commission for FY24.
Yeah, I mean, the EMS is part of the Health Commission. It's part of our overall budget, EMS is. But those particular FTEs are going to sit in the CAF Bureau with our neighborhood trauma team.
What did you mean by it's not part of the FY24 budget?
Well, I'm trying to figure that out right now. I don't believe that was part of one of our initial requests, but I'm checking in with some other colleagues on our team right now. And it does look like that was added to our proposal for our FY24 budget. Yeah, it looks like it was kind of a late add to our initial new investment requests.
That's interesting.
Yeah.
Okay. So I think, obviously the community is very interested in trauma response teams or FTEs, and, it would alleviate a lot of EMS's work to have FTEs, or I don't know if it's, best team clinicians increasing or supporting those services. But essentially we are getting a lot of emails, and I mean by the hundreds, to increase the budget, to remove it from Boston Public Health Commission because it has not been executed in the last year or two since the program was initiated, or I'm not sure which counselors worked on it prior to my time here. But essentially, to make informed amendments, I would like to understand if it is a thing, and if it isn't a thing, then how many do we need before folks start suggesting increases that are impractical to your budget or for execution purposes. So I'm looking at it, and I would like some clarification. If you can submit it to me in writing, that'd be great.
No, understood, Councilor. No, we'll provide you with all the information around this particular request and kind of what our thinking is for the game plan going into FY24 for this.
And what would you say, counselors, and I'm not sure, this is more, it may be a policy question, but in terms of counselors making amendments to have the FTEs in a different department, considering that they feel that the Boston Public Health Commission has not been able to execute. And being that it's a quasi agency, we're not able to necessarily, move line items in that way. We're able to decrease or increase or decrease. So it's kind of, it would be difficult for us to even suggest what the funds go toward. So do you have any recommendations there in terms of moving the program to a department internally?
If that's a question for me, Council, I'd have to defer to, my other folks here, the programmatic folks here at the Health Commission who have a better handle around that particular program and what their thinking is. I know that they've had a lot of conversations with the mayor's office around that, all of that work over the last year. We know that's a hot topic, and I know there's been, like I said, a lot of various meetings around that recently and ongoing. So again, we can provide you with more information and set up additional meetings with you as necessary, but I'm going to have to defer to the other program folks here at BPHC for that.
Okay. Understood. When I asked it, I felt like it was more of a programmatic or a policy question. And I appreciate you answering the others. If you can submit that information to me, again, that is a line item that folks are considering decreasing in BPHC to move to an internal department here. That's all I have. I would like to keep my word in terms of wrapping us up before 5 o'clock. I thank you so much for your work and your dedication to our city, to our people. You've been here before me. You know this work way beyond what I can research in the last year or so, and I appreciate you indulging me in this conversation. And look forward to reaching out to you, a courtesy phone call if amendments should be proposed, at least to communicate or to get feedback from you that know the job better than us, the counselors coming in, researching, filing policies, and asking you to do things in your department. It should be definitely a partnership and a collective effort. So I appreciate you and respect the work that you do. And thank you so much for all that you do. If you have any closing remarks, now is the time.
From an OEM perspective, I just would like to thank you very much for the decorum in the hearing and the balance of it. We greatly appreciate it and look forward to continuing to work in this space and be responsive to the councilors as needed and helpful. So thank you very much to all of you. Really appreciate the opportunity.
Thank you, Chief.
And council, also from us, thank you very much. Appreciate that you had a scramble to reschedule us, but you got the redistricting done. Congratulations. And again, any questions or anything else, we're always available. You know that. Thank you. And that's it.
Thank you so much. Chair Lucienne will appreciate that. It was a huge undertaking for her and half as an undertaking for us, but definitely appreciate you understanding and being flexible with that move. We all, I don't know anyone in the council that says EMS or emergency should be reduced. I think that it's more of a, how do we support you more? How do we make sure that you have what you need in the budget in order to execute your work properly and to increase in capacity or while you work toward building diversity in your departments as well. So I thank you all, and please reach out if there are any feedback or any things that you may have for me. This hearing is adjourned.